bring in real giants in different areas to give these keynote sorts of presentations. And today we're very lucky to have Felicia Huppert giving a presentation. Now, many of you know Felicia because she had an appointment here for a number of years, but long before she had a connection here, she's done some really amazing sorts of things. So she's one of the godmothers, if you will, of the science of well-being and how to use well-being to promote flourishing. And she's done some really interesting work with great big organizations to move global thinking into accepting a perspective of positive psychology, of mindfulness, of well-being, of flourishing, those sorts of concepts that were just not given any credibility even a decade ago, let alone 20 years ago. Felicia and I first had contact through a mutual PhD student when I was in Oxford. And when I came back to UWS, I was fortunate. I talked to Felicia about that. Then when we moved to ACU, we were fortunate enough to be able to bring Felicia here to work with us. She's going to talk about some really interesting big picture sorts of things now. How the science of well-being has now gotten an international credibility with not just psychologists, but also economists and social policy and government. And so lots of governments are now paying attention to the notion of well-being and happiness and the notion of flourishing in a way that hasn't happened in the past. And some of that is due to some of the work that Felicia has done, some of the work that she's done herself, but also some of the organizations where she's been a mover and shaker. So we'll have a chance to hear some of the big picture sorts of things that are happening in the science of well-being. Thank you.
Where would you like me to?
This one,
just here?
Yeah.
Okay. Thank you so much for that lovely introduction. And thank you for inviting me today, but also inviting me to come to UWS and ACU in the first place. Yeah, I was very fortunate to be connected with you in the end of your stay in Oxford. And that happened to coincide with a time where Cambridge University, in its wisdom, still required mandatory retirement, unless you were Stephen Hawking or had so many funds that they couldn't possibly, not keep you. And I didn't fit either of those criteria. So it was wonderful. I'd always wanted to come back to Australia. 45 years in Cambridge was fabulous, but it was long enough. And yeah, it was lovely to find a home. And lovely to be back here. Gosh, I don't think I've been here for about 5 years. And great to see some, old colleagues and to meet some new people. And thanks so much, Ricky, too, for organising everything. It's been fabulous. So, yeah, where do we start? It's interesting to think that it's been about 25 years since Martin Seligman launched positive psychology. And it's not that there were not people already working in the science of well-being. There certainly were, including some great names like the late, great Ed Diener, and of course our marvellous colleagues, Rich Ryan and Ed Deasy. But what happened was he brought us all together under an umbrella. And that helped enormously in fostering the research, practice, in making it publicly available. So that announcement of positive psychology as a thing really made a big difference. And the most important part of it, I guess, was recognizing that while it was really important to treat and prevent problems, related to psychology and learning and all of that sort of thing, it wasn't enough. And what we needed to do is have a science of what worked well, what made people flourish. Most of the work, I think you'll agree, was about individuals. and developing knowledge about the skills and characteristics, attitudes, behaviours that made individuals flourish. A little bit about the interpersonal, and even less, I think, about organisations and communities, but some work in that domain. And nice to see, that that's expanding in some ways, like the work of Isaac Prilatensky. I don't know so familiar with Isaac's work on positive communities. I think Isaac is moving to Melbourne, which is pretty exciting. But the thing that I'm interested in is we have this amazing body of theory, of evidence, of practice that I think could perhaps be applied even more broadly. So to apply it to how to create a better society and a better global environment as well. So that's what I've been trying to think about in recent years. So, oops, I'm pressing the thing.
I'll get you forward anytime.
Sorry?
I'll move forward for you. Okay.
Yeah, oops, you go back.
Yeah.
Yeah, lovely. So, of course, I think we all recognise that we are part of a larger ecosystem. And those outer layers of the system profoundly affect how we are. They affect our health and well-being. They affect our attitudes, our beliefs, and our behaviours. And it's really important to recognise that and not assume that everything about us is internally driven, under our control. We are profoundly influenced by those extrinsic layers. But equally, we do have inner resources, inner capacities, inner ways of being that influence those outer layers. So, for example, the evidence is that when somebody is thriving, flourishing, has high well-being, that has an impact on the people immediately around them, family, their friends, but even beyond that, their friends' friends and their friends' friends. And so out into communities, and that has a ripple effect into society and into the environment. And for instance, some years ago, Adina did some studies of comparing happy people and less happy people, and discovering that people who were happier, and that's of course the only measure of well-being, but people who were happier were much more likely to take social action that benefited others around equality, around environmental issues, and so forth. So there are these positive effects that happen into that system. So there's both the effect of the outer layers on individuals and the effect of individuals working outwards, so it's bidirectional. And oops, sorry. Yeah. And the effect of how the outer layers can affect well-being, I think, is very well represented here in this diagram from WHO, looking at the Sustainable Development Goals. So health and well-being is number 3, and they've put it in the centre, which I think is where it belongs anyway. And clearly, it is affected by all of those specific areas. And what's very interesting is this emphasises the external factors that we've. But as I was saying, there's also our own inner resources, capacities, attitudes, and so on that have an effect on those external layers. And that's come to be recognised in a very interesting way recently. A group of researchers, I think mostly beginning in the Nordic countries, in Stockholm and places, were asking the question, why is it that the SDGs are not meeting out the targets that have been envisaged? So they were set in by the UN in about 2015, and the idea is that they should be reaching their targets by 2030. And when you look individually at each of these 17 goals, very few of them are doing very well in terms of progressing towards those goals. So these researchers asked the question, why? What's getting in the way? And they decided to do this extensive survey on people who were playing really crucial roles in relation to trying to implement the vision of the SDGs. So they ask them basically, what more do you think you need in order to meet this vision by 2030? And what was fascinating was that the answer had to do with the inner resources, the inner skills and characteristics that they felt were lacking. So this led to a report in, I think it was the end of 2021, and a framework which is called the Inner Development Goals. So based on these surveys of these hundreds of people playing this major role in trying to implement the SDGs. So the survey identified 23 key areas of skills and characteristics that they felt would help them towards implementing the vision. And they could be amalgamated into these 5 key areas. And I think this is a very interesting diagram. And what I want to suggest is that as psychologists, we can use our theories, we can use our evidence to actually help the IDG folk implement these new inner development goals. And I'm going to be saying more about a potential framework shortly. So this is quite a new development. It's becoming very, very big. But there's another development that's been around for even longer. It's not unconnected, as we will see. And that's the idea that our economy is not serving us well from the perspective of well-being. And traditionally, the measure of economic progress has been something like GDP, gross domestic product, which is really how much money is spent from all different sources on a whole range of things. Now, the problem is, as has been well recognised for a long time, GDP can go up when there are terrible calamities, natural disasters, wars, you know, when all of the flooding has taken place on the East Coast recently. Rebuilding all of those facilities, moving houses to higher ground, all of that raises the GDP. That's certainly not a great thing. When there's higher rates of crime and we build more prisons, this is the GDP. When we cut down trees in ancient forests and sell the timber, increases the GDP. And it's been recognised for a very long time. I think some of you will be familiar with the quote from Robert Kennedy back in the 60s that GDP basically measures everything except that which makes life easier. So there's been a long recognition that our economic measures are just not good enough, and that economic growth is not the be-all and end-all of everything. But what's wonderful is that finally major changes are taking place around the world towards an idea of a well-being economy. So an economy that's based not just on economic growth, but on what is good for people and the planet. And more places are taking this idea very, very seriously. So it's not that, you know, we are there to feed the economy. It's that the economy is there to create the kind of well-being that is truly valued. And so one of the big efforts in this area is developing better metrics. So instead of just measuring GDP, we should measure things that show genuine progress. So there's been a lot of work towards that. Say more about that shortly. Some countries have even gone beyond the idea of measurement, and measurement is very common now, I suppose most countries, some measures of well-being. But some countries have gone beyond that to say, sure, of course we need to have better measures of progress, but we also need budgets that reflect the implementation of policies that get us to those measures. And a number of countries, doing something wrong here. A number of countries have signed up to be what's called wellbeing economy governance, where as well as the metrics of wellbeing, they've actually implemented are beginning to implement wellbeing budgets that support these ideas. The most recent is Canada, who's joined this group. And one of the problems that has arisen in the last few months is that in 3 of these countries, we'll have to have women prime ministers. These prime ministers have stepped down or been defeated in elections. So the first was New Zealand, the next was Scotland, and just over the past weekend, Finland. The Prime Minister of Finland lost the election. So it's a bit of a concern about how much this movement towards a wellbeing economy, wellbeing policies and wellbeing budgets will continue under the new regimes. One hopeful thing is that it wasn't, these efforts were not just tied to left-wing versus right-wing politics. There were politicians from right across the spectrum who were very interested in the idea of wellbeing, economics. So the hope is that this will continue. But it's not an easy thing. It's not that you can suddenly, go from, this measure of GDP, where, for instance, huge amounts of expenditure were given over to mopping up the fact that people, because of inequalities and racism, whatever, had poor health, poor education, or poor housing. And so enormous amounts of money went into remediation and things like that. Whereas the hope is that in time, the conditions will be such that many fewer problems arise in the first place. And that takes time. Wales is particularly interesting because in addition to, thanks. In addition to the general idea of signing up to the civil economy, they've had a particular interest in looking at the well-being of future generations, and they passed this act back in 2015, where all policies from every public body have to be evaluated in terms of their impact, their probable impact on future generations. And what's more, there's a commissioner appointed to make sure that this is implemented. And I think this is a very inspiring approach. And I guess I'm a little surprised that they're so far the only country that's done this. So this brings us to the question about what about Australia? And of course, this might happen here. What we know is that our Treasurer, Jim Chalmers, has for a long time been very interested in the idea of a wellbeing budget. And at the end of last year, Treasury launched this invitation to submit, to make submissions to Treasury about how we could make sure to measure what matters. And one of the very interesting things that happened was led by the University of Canberra. There was a fantastic conference in, I think it was last November, very wide-ranging conference with people from all over the country, many people from public bodies, academics, all sorts of practitioners, researchers, talking about building well-being into policy and action. And following that conference, we were all invited to contribute to a submission to Treasury, and did so. And we don't yet know the outcome, but what I love is many things about this submission. One is the democratization of the idea of well-being. So it's not just that we experts define what is well-being. And by the way, someone asked me earlier, what do I mean? And to me, it's, in the broadest possible terms, it's the combination of feeling good and functioning well. But it's not just what we experts say, it's what does the general public understand by well-being? What matters most to them? What do they want to see the government supporting? And this isn't just focus groups, it's tens of thousands of people being interviewed around the country to get their understandings. And a proper representation, not just of urban folk, but also regional and remote, and Indigenous, So I love that there's this democratization. And there was a fantastic Indigenous representation, both at the conference and in the submission. And sorry, I went backwards. I just haven't got the hang of this one. Ricky, can you just take it? Thank you. Yeah, and in the submission. And led by this national study of Aboriginal and Torres Strait Island wellbeing, Ray Lovett at ANU. I think is one of the people leading this, but it has national representation. And if you go onto the website, there's this gorgeous art just trying to represent the understanding of wellbeing. And just in a nutshell, do please check it out. Some of this represents the healing power of water, of culture, and of the land. And in the centre, we've got the sun radiating positivity and connectedness. I think it's just the most beautiful artwork. And I think the important thing about involving all these different players, different cultures, different locations, is that what it means is when we do get to the point of developing metrics, agreed metrics, indicators, and changing policy, it's going to be fairly specific to areas, to locations, to cultures, and so on. And that's an important thing to recognise. It's not generic, it's not going to be the same for everyone in Australia. So I think that is one very important. And I think the other thing I want to say about it is, I mentioned to her earlier, this area is still very much dominated by economists, and a lot of them doing a very good job. But I think what's lacking is psychological. Because I think as psychologists, and perhaps particularly positive psychologists, we're very well placed to understand, for example, how it is, what are the mechanisms through which the external factors influence our well-being. Because if we want to change policy and develop better programs, we need to know that. So, for example, I suggested in the submission that among the things that we should be measuring are the self-determination theory, the basic psychological needs. Because in order to develop a good policy, we need to know whether an external factor is having an influence on, let's say, autonomy, or competence, or relatedness. And if we don't know that, we're not going to be best placed to know what it is that's changing. So I think we do need much more psychological in terms of the world in the economy. And a lot of people to sort of join this. Now, there's an overarching idea that imbues many of the things I'm going to be talking about. And it's this idea that we need to move from me to we. So in the top left-hand corner, the focus on me doesn't serve us well. And yet it's very prevalent among many societies, particularly the more materialist, collectivist societies. In what ways? Well, you probably all be familiar with the classic study by Elizabeth Dunn, who looked at whether spending a small amount of money on oneself or on someone else had the bigger effect on happiness. So it was a randomised trial with students, same sum of money, and we know the result. The result was that both groups had an increase in their happiness, but it was substantially greater in the group that spent it on something else. But the part of the study that I particularly like is after the study, the students were debriefed, and both groups were asked, who do you think would have had the greater increase in happiness? Both groups assumed it would be spending on themselves. And that's just not the case. It's not what the evidence shows. And it's clear to me that we need to educate people to understand that the focus on me isn't not serving them well from the perspective of well-being. So moving towards a focus on us is more helpful. Loneliness is another case in point. That people very much sort of living by themselves, living alone, feeling lonely, it turns out that one of the best treatments for loneliness is getting lonely people to volunteer, to work with others. Not really surprising, not that difficult. And what about from short term to long term? So when we focus on what's good for me right now, that's not always consistent with what's going to be good for my future. I think some of you here will have discovered that, you know, doing a research PhD is pretty tough. It may not be good for your well-being right now, but it's going to make a big difference to you in the future and to others in the future as well. So the important thing here is to move from the top left-hand corner to the bottom right-hand. So to move from me now to us in the future and to what's good for future generations. Next picture. So I want to turn now to a framework that some colleagues and I have developed that can help this to happen, to move from me to we, that can help with the implementation of things like the development goals. And this is based very much on wellbeing science, positive psychology. And it's just has these three elements, which we call open mind, open heart, clear thinking. And I'll say a little about each. So an open mind is about being aware of whatever is going on right now, around us and inside us, without reacting immediately or rushing to judgment. In other words, mindful awareness. And there's a massive amount of data showing the benefits of doing this, of becoming aware of what's happening right now. So the behavioural data, there's some physiological data, there's the effect on stress reduction, hormones and so on. There's the telomeres that help us with healthy aging. All of these things are influenced by people who practice this type of awareness. And what do I mean by practice? Well, there's formal meditation, which is very helpful. But it can be as little as 10 minutes a day. A formal meditation can make a big difference. There's a study that was reported in the Harvard Business Review, but with further details as well available. In several senior leadership settings, showing that as little as 10 minutes a day makes a significant impact, not only on the leader's own well-being, but on how they manage in very complex situations and their ability to collaborate with others. So as little as 10 minutes formal meditation, but informal awareness, informal mindfulness at any time of day turns out to be actually very, very helpful as well. And it's extremely important to do this because we are so busy. Our lives are so busy, rushing from one thing to another, bombarded with information, social media, whatever. So the opportunity to just sit, just be with thoughts, with feelings, with bodily experiences. How often do we give ourselves time to do that? And yet, as I say, the evidence shows many benefits. So what are these benefits? So the important thing is to become aware with an attitude of gentle curiosity. It's not a harsh, cold awareness. It's this sort of curious, gentle approach. So there are clear benefits to emotional regulation. Being able to sit with difficult emotions and be okay with difficult emotions, as well as saving positive. It helps us to see more clearly and listen more deeply. And one of the really important things I think about this is it allows us to pause before responding, rather than react in automatic ways that might be unhelpful. And that in turn leads to making better decisions, taking more sensible action. So, you know, we're in touch with the fact that actually I'm feeling pretty angry right now, although I'm not. Just knowing that, taking a pause and thinking, so how shall I respond? And that pause allows us to respond more wisely. So instead of yelling, throwing something, thinking, okay, I'll take a few deep breaths. Okay, and here is a better way to respond to that situation. So it's very real. And overall, mindful awareness is a way of training the mind, just like exercise trains the body. It really sort of general sensible. Now, it's sometimes said that mindfulness training, you know, mindfulness practice can be very selfish. It makes you feel better and less stressed, you know, and so on. But the evidence is that it actually has effects out there on other people and other aspects of life. And one of the most important studies was done here. James Donald and his colleagues from here did this large meta-analysis looking at a whole range of different mindfulness training programs that happen to have measures of pro-social behaviour. And they found a very clear effect on improved pro-social behaviour, even when the program itself never talked about the other. You know, it wasn't outward oriented, it was only inward oriented. Even so, it has benefits on external behaviour. So in the top left, it just indicates improved relationships. And there's a lovely story that I think some of you may know about a psychiatrist who got very sick of his patients telling him about this mindfulness thing that they were doing and thought he'd better try. So he did a standard. Is it?
That's what it's.
Sorry?
Sorry, you can answer.
Is it? Do I need to speak
wrong
up?
Number. That's a wrong number. Wrong number.
Sorry?
It was a wrong number.
Oh. I should, you know, shut up. Sorry. Anyway, yes, so the psychiatrist did one of these standard 8-week courses, 2 hours a week, recommended about, 40 minutes a day of practice. And at the end of the course, he said to his wife, I'm really glad I did it, to get a sense of what that's all about. He said, but I'm not going to bother practicing anymore. She said, oh, please do. You've been so much nicer to live with. So, that's an anecdote, but there is also evidence of better interpersonal relationships. Plenty of evidence of that. And then there's also the idea of team. So teams collectively practice mindfulness. It can have very beneficial effects. Bottom left is House of Parliament, UK. And some years ago, one of my colleagues started teaching mindfulness in Parliament. Now, you may say, can't have done much because look at the UK, it's been a disaster area. And that's true. But for the people themselves who were doing the courses, both the parliamentarians and the staffers, what they report is a very different approach to the complexities of issues that they're dealing with, their attitude toward people from other parties, and so forth. And they ended up doing it not just to reduce their stress, get of their constituents, but also the recognition that if you're mindful of what you're thinking and planning, you can better see where your biases are, your values are, but also the biases and values of others, and just be more open to understand. So this is now spread to many parliaments around the world, and it's just a little tiny thing. It's a small proportion of people in Parliament who are doing it, but the hope is that it's like a seed. That here in Australia, just 2 weeks ago, is the first seminar on our. We have an Australian group of this so-called Mindfulness Initiative, and among the speakers were Craig Hassett, some of you may know, Monash University, who's been teaching mindfulness to medical students for decades and finding tremendous benefits compared to medical students that don't get that training. Kathy Freeman, apparently is a practitioner. Also the speaker of the House of Representatives was one of the presenters. And it was also the launch of the Parliamentary Friendship. And many people have now already signed up to do the courses that are going to be offered. So look, there's just a glimmer of hope. It's just a tiny seed, but let's hope. And in terms of environment, when we're mindful of our actions, for instance, as they relate to what we eat, what we wear, kind of transport we use and so forth, then we become more of what we could do to make a bigger difference to the environment. So moving on, open hearts. So when we see struggle with something, to motivate us to help. It's important here, I think, to distinguish between empathy and compassion. So with empathy, we feel what the other person feels. So if the other person's suffering, we can suffer too. And the trouble is that can lead to personal distress. And therefore we can't necessarily be helpful if we're feeling distressed ourselves. So the important thing is to move from to compassion. And in compassion, we're very clear it's their suffering and we're able to help because we have divorced ourselves, we've detached ourselves. And what's really interesting is the vast majority of research in this area has looked at the effects of feeling or acting with compassion towards others, but not the effects on others, but the effects on the person who's acting with compassion. So we're back to the individual. And there are a lot of individual benefits when you act with compassion. It turns out that such action, kindness and compassion, seems to be hardwired. We see it in very small children, we see it in social animals. Of course, sometimes it isn't there. We can also see people being very, very cruel. But the evidence seems to be that it can be learned. Kindness and compassion can be learned. And as I say, most of the studies are about the person providing the compassion. But what about the effect on others? And I've just got a couple of examples here. One is a lovely study done in a large Spanish corporation where employees were randomized either to give kindness, acts of kindness, receive them, or call them. And this was over a several-week period. And what was found, and I think some of you find that very interesting, that it not only did well-being increase, but so did autonomy. And I think that's fascinating in both the givers and the receivers. But then there was also this idea of contagion, where the people who had received kindness were 3 times more likely to show kindness to others. So there's this whole sort of positive contagion. What about in relation to kids? Now, I have a vivid memory from when we were at UWS, the gorgeous, gorgeous campus, and we were having one of our staff meetings, and Rhonda was talking about some work she'd been doing on anti-bullying. And I had this picture of her shocked face when I said, I'm not in favour of anti-bullying programs. But it's not good enough. You know, anti-bullying, not bullying, it's not enough. What we need is pro-kindness. And this is one of the classic studies from University of Wisconsin showing the benefits of sort of mindful pro-social training, which is just 12 lessons in ICT. And the benefits were, yes, social competence, mental flexibility, interestingly, and ability to delay gratification. So it really had quite effects. And I think there are more and more programs now that are looking at more kindness in schools, more compassion in schools. So moving on to one of the things that really excites me these days, and it's very, very urgent, the Global Compassion Coalition. It only started around but it's brought together all kinds of organisations from around the world who are working in this field already, and many, many, many individuals. And the idea is basically to create a caring world where we care for people and nature. And also the recognition that compassion is not just something soft and tender, it can be, but it's more than that. It actually takes courage, strength and wisdom to be compassionate in the face of suffering, to stay there and actually make a difference. And this is important at the level of individuals, but also organisations, this idea of compassion as being an underlying, overarching approach to making a difference. And you can also see, particularly on the left there, how it might fit naturally with the idea of a wellbeing economy. And I'm on the advisory council for GCC, the Global Compassion Coalition, and I've been asked to try and integrate compassion into the idea of wellbeing. It's a big role, and I'm not going to do that, but I'm very, very happy to contribute, and I'm very much looking for people who might want to get involved in it. This organisation is. Oops.
That's moving. Screen's frozen. The screen's frozen.
I'm sorry.
The screen's frozen. I'm just going to reset.
Thank you. Yes, so this organisation has great ambitions, and in practical terms, it will be funding research. It will be putting out a popular magazine. It's going to have an annual compassion festival. It's going to launch campaigns and so forth. It really is developing in the most extraordinary way. And if, you know, I really encourage you to take a look at the website, which is just packed with information, with resources, with research findings. And in fact, the official launch is taking place in just 10 days. And I think it's going to be a wonderful event. So anyone who's interested, please do take a look. And the person behind all this is someone called Rick Hansen, who you might have come across. He's based at the Greater Good Science Centre at Berkeley. And Rick is well known as a teacher, practitioner, researcher, and he and colleagues have come up with this idea of positive neuroplasticity. So we know that the brain is very plastic. But we also know that whatever we nurture will grow. And if we nurture negativity, if we nurture hostility, if we nurture polarization, if we nurture criticism of ourselves or others, those neural pathways will grow stronger. But if we nurture strengths in ourselves, if we nurture kindness, passion, gratitude, so forth, it's those pathways that are strong. So I think it's a very lovely idea. So finally, three core capabilities is the idea of clear thinking, which is essentially similar to critical thinking. We need to carefully evaluate information so that we can know what is true, what is accurate, and therefore respond appropriately. And the way to do this, I mean, the careful evaluation involves things like understanding the source of the information and the motivation of whoever is putting up that information. That's really, really important. Having a general attitude of healthy skepticism is a good thing, but also being willing to expose yourself to other perspectives, and most importantly, being willing to change your mind based on the evidence. Now, I know that every education system probably talks about the importance of critical thinking skills, And I completely agree. It's crucial, and today more than ever, because we're presented with so much misinformation and disinformation and algorithms that reinforce what we already believe. So it's really tough, to find a way through all that. So it is incredibly important. I did a search not long ago to see what research had been done, looking at different programs for developing critical thinking skills in school context. And there was very little solid literature telling, describing how it's best done, and looking at outcomes, but not just performance, not just performance at school as an outcome, it's a bit of that, but looking at outcomes in relation to decision making and beliefs and so forth. So please, if anyone knows about research, I'd love to hear about it. But otherwise, I think this is an area that is so ripe for investigation. Another thing, just to mention, some of you will be familiar, I think, with Adam Grant, who works at the business school at University of Pennsylvania as a positive psychologist. And a couple of years ago, he wrote a book called Think Again. And it's fabulous. It's a wonderful account of how we can think more clearly. One of the particular take-home messages for me was his idea that all of us need support networks to encourage us, to help us when things are difficult and so on. But we also need challenge networks. So good-willed people who will challenge our thoughts, our beliefs, our behaviours. And that's, I think that's a very wise piece of advice. I don't exactly have a challenge network, but I've got 2 sons who challenge me all the time. So I'm pretty grateful for that. So, oops. Sorry, I think I've skipped.
There you go.
Yes. So this is an interesting initiative. It's been used across many countries and many individuals, whereby people are exposed to someone in a one-to-one conversation that has a totally different political perspective to them. And the way it works is, and there's a particularly good study that was done in Germany a few years ago. A major media company put out a survey of people's political attitudes and then match people who were as far apart as possible in their political attitudes. 19,000 people were matched. 45% agreed to have a one-to-one conversation with the person they were matched with. And because it was pre-COVID, it was all done in person. And it was very interesting. They were also assessed afterwards. 80% said they were really happy with this conversation. 60% said they intended to stay in touch with the person. And there were other really interesting changes as well. So both groups reduced their stereotypes about politics and had a more nuanced approach to their political views. And both groups showed greater trust of citizens in general. So I think a very interesting initiative can be used in many, that this general paradigm can be used in many. And then in relation to schools and education, I just love this study. 11,000 9-year-olds in Uganda randomised to these 2 conditions. And it's only 9 lessons in basically critical thinking about medical treatments, because apparently there's a lot of disinformation about medical treatments, like you can treat or cure HIV. And so these kids were taught actually how you think about whether a treatment is effective or not. And you can see some of the videos, and it is so gorgeous to hear 9-year-olds saying in their own words, why we need randomised control trials when we do, when we're looking at what treatments are effective in the health care. And a huge difference in how well they did on a test. 69% versus 27%. That's an enormous difference over a very short training period. And I think part of it was it was such an engaging study. It's done with comic books, with activities, with songs. So this was very, very effective. Now, what we don't know is how long the effect lasted. We don't know whether it generalized, but this is the kind of critical thinking that I think one needs to see more of, more kind of studies that one needs to see. Okay, so finally, putting these together, our suggestion is that if you combine an open mind, an open heart, and clear thinking, this leads to wise action. And my feeling is that in terms of education, these things are among the greatest gifts that we can give children in education, is it will affect every part of them. And if you want to read more about it, a group of us published a book a couple of years ago that goes into the framework and the evidence in much more detail. And it also looks, it applies these frameworks, these ideas, evidence across all these different domains of life. And I brought along a few copies of the book, so particularly for any students who might be interested to offer them. And in fact, this book, Creating the World, was the subject of the most recent European Conference on Positive Psychology that took place in Iceland last July. Do you know if you agree with that? I thought it was a marvelous conference, and I think it really, to me, it really put positive psychology on a new level. You know, looking at this more global picture, looking at how we as positive psychologists can contribute to creating better societies and a better environment. So just to finish, a lot of change is needed to economies, to inner development, to education, to many things, and change is never easy. But change is important, and in terms of the environment and quality and so forth, it's also urgent. So we really have to make sure that change starts to happen. And as I said, I really think positive psychology is a very important role, both because of our understanding about the programs that are effective, about the mechanisms through which these programs work, and also our dedication to recognizing that you need to trial things. You need to try things out on maybe a small region before rolling it out to everyone. But I think we have a lot to contribute to these various initiatives that I've been describing. And I can't resist ending with this beautiful quote from the primatologist, Jane Goodall. You can't go through a single day without choice of the world around you. So make sure it's a positive influence. So what I'd like to do now is just open it up to discussion, because I suspect that there are some of you here who are already working in some of these areas, or might want to talk about additional ways that positive psychology might be able to contribute. So I'll leave it there to you. Thank you.
Without versus compassion for others. So the focus of your presentation right recently was the benefits of compassion for others. How does self-compassion and compassion for others relate? What's the connection between them? Is there a synergy? I assume there's a synergy between them.
Oh gosh, it's a really, really good question. And I know that in the past I've tried to look at the literature about whether if you increase self, so many of us have this very, very harsh critic inside us who's, not doing us any favours necessarily. So if we're more compassionate to ourselves, it certainly helps us. But the question is, what effect does that have on compassion towards others? And I'm sorry, I haven't realised that search recently. But I remember thinking it wasn't as strong an effect as I had expected. That being compassionate towards oneself didn't necessarily produce greater compassion towards others, but perhaps you have a.
That is interesting. I started looking a bit, working with Maddie on self-compassion, and I was just surprised at how the self-compassion literature is substantially focused on self-compassion, and I would suspect that compassion for others would have a stronger positive effect on self-compassion than the other way around.
Oh, that's very interesting.
And that's to me a fascinating issue that
And
I'm interested.
I don't know if that's been examined, but does anyone know? It's very interesting.
We've been looking at it recently and experiencing recently. I find that there is an interesting variation. Most people, self-compassion, happy for yourself and other things that go hand in hand and are positively associated. We didn't. I feel happy for myself. I likely to be happy for others as well. But there is a small subset. Case increasing either self or other compassion with their public for their own space. So addressing that context or either. Points to the fact that suggesting increases in self-compassion universally across the board for everybody, they actually become counterproductive. Right? This is a concept that the public.
Oh, thank you, Dr. That's very interesting, and I'd love to read more about this. Is there something available?
It's under review, but it should be definitely like my favorite review. There is
Fantastic, thank you.
Your points, ages have changed going from I to we. I want to ask you about if the government years or environment or maybe competitive, make that transition. That's what you come out with. Or maybe it's even a chicken thing. I don't know what goes for higher to we, the environment to be first and then scared. Comment.
No, I think that's right. I mean, it's a very real issue when there's scarcity and basically really to survive. It's much harder, I think, to be generative in that situation. And I'm smiling because it links with some of the research on delayed gratifications and the fact that it turns out kids who didn't delay their gratification who were just responded, right away rather than waiting for the second opportunity to get much. It turns out that a lot of the kids who came from tough backgrounds, where if you didn't help yourself right away, it wasn't going to happen. So no, it's very your response, your approach to it.
I'm not sure. I'm probably facilitate the transition. I just imagine a family conversation when the parents want the child to look after themselves first before you share your money or whatever. I just wondered about that facility and having these dress kind of arguments. I can't. No answer, just what that's about.
Right.
About the well-being economy. So you mentioned GDP, and that seems quite an objective way of measuring increases, not necessarily improvements. What are some of the ways in which well-being is measured?
Yeah, I should answer to that. what's interesting is that nearly all of the countries who are looking at it tend to measure objective well-being rather than subjective well-being. So they do have specific questions about, you know, have there been improvements in the healthcare system measured in a certain way? You know, is education freely available? You know, preschool classes and things like that. So partly I think because it's coming from economists, the well-being measures tend to be objective measures. And again, that's something I've been critical of. Sometimes in these studies and, you know, this country-wide investigations, they only have a single question about subjective well-being, which is, you know, are you satisfied with your life? And it seems to me profoundly important to start asking subjective questions. Sure, maybe there's some evidence the health system is improving in an objective way, but how do people perceive it? Because after all, it's the way we perceive things that influences our own well-being. So one of the big pleas in this submission to Treasury is to do more work on subjective aspects of well-being. For instance, the OECD has pioneered a lot of this work on measuring well-being, and they have I think it's 9 domains that they measure. But, you know, things like education, so forth, environment. And one of the domains is called subjective well-being. Well, that's not a domain. What I've been arguing is that we actually need a subjective component for each of the domains. So I think there's a real lack there from the perspective of psychology. And I hope this is a gap that people are going to start to fill.
To follow up on that, what would be, I guess, your ideal way of measuring that? Is having spoken to a few people outside of psychology, one of their concerns with measuring subjective well-being is that, say, if it's something like a scale of 1 to 7, 7 for me might look different, or it's a 7 for you, and that might be different from country to country. So, especially when comparing against countries, so saying, oh, this country did X and they had these many improvements or this improvement. How do you go about it?
Look, you're right. It is hard to compare, but I think I hope you correct me here. But there are methods for seeing how people use the scales, and we can then take those methods into account when making comparisons. That's my
there's an implicit assumption that so does influence your happiness and your sense of well-being, and so it's more controlling for it, and some attempt to control for it is throwing the baby out with the bathwater. I mean, I'm quite intrigued with some of the things that we've done where they're looking at vast numbers of internet exchanges anonymously in theory, in different areas, and evaluating them for positivity, negativity, and so forth, and things like that. And I don't know that that's necessarily the answer to what you're saying, but I don't think that there's an easy way to get around that. I mean, at some level, subjective well-being requires that you ask people to evaluate themselves for their situation, and that's always going to be that. I mean, the fact that it is subjective is the positive aspect, but also the Achilles heel.
Well, question from the online audience, CG.
Yeah, so thank you for your presentation. I'm very interested about it. Can you hear my voice?
Yes.
So I'm interested about like the well-being of individual and also the well-being from me to we. And I think about if the people live in the different types of the societies or have different type of the culture, like individualistic culture and collectivist culture, maybe the people in different culture, they may think the things different. Like from the people from the collective culture, they may think we first, and then generalize we well-being to the me well-being, and then go back to the we well-being. But people maybe from the individualistic culture, they think about we first, me first, and then they generalize me well-being to we well-being. So I just think about whether the culture seem like leads people to think interpreted well-being in different ways, so that they generalize the well-being from different perspective or different way around. So what do you think about it, the culture thing?
And look, I mean, you make a very important point, and I think it's one reason why there's a lot of effort now in people who work with the wellbeing economy to try to capture what it means for people in different cultures. But as Herb's saying, you know, it's going to end up being tricky, which, you know, however you approach it, because, you know, that frame of reference can just make a big difference. And how we'll ever get to, you know, being able to make direct comparisons that are valid, don't know. It's, yeah, we may not. But the question is it nevertheless still worth doing for what we do get out of it, even though it's so far from perfect? My sense is yes, because as I said, how we perceive the world to be is really an important aspect of our well-being, not just the objective facts of the world. So we have to try, and yeah, maybe we'll get better at it. I hope so.
Yeah, I agree. Thank you.
Thank you. So one more question, last one from Maddie. So it's just coming up on the screen now. In the middle of a work day, thank you very much. A general question: out of every technique approach you've mentioned, which do you feel would bring about the biggest change in well-being on a global scale?
It would, I suppose, the most fundamental of all of these, so, you know, what we call core capabilities, is awareness. I mean, there really is nothing more fundamental than this, because everything else is built on that. You know, you can't be passionate unless you notice that someone is struggling, suffering. So you need to be aware. So I suppose in the course of an ordinary day, taking time to just be aware of how things are, and you know, the clarity that brings, the calming that brings, I guess, maybe the single most useful thing if one just needs one thing.
Very good, Maddie.
Thank you. It's the building block for everything else. Thank you.
Okay, so that's it. Anything else? Right, I think we'll call it the day there. Thank you very much, Felicia, and thank you for the award.
Sorry?
Have you met Maddie before?
Only online.
So you know.